Debbie thought she had found a bargain, a Medicare Part D plan for just $5 a month. She smiled, clicked enroll, and congratulated herself for being such a smart shopper. Then January arrived. She stood beneath the bright pharmacy lights, winter coat still buttoned, while the pharmacist looked at the computer screen and said, "Your total today for this prescription will be $287." Debbie blinked. For one prescription? That $5 plan suddenly did not feel like much of a bargain. And here is the truth. The Medicare Part D plan with the lowest monthly premium may actually cost you the most. The plan your spouse loves or the one your neighbor swears by could also be completely wrong for you. Because choosing a Part D plan is not about finding the best plan, it is about finding the plan that works best with your prescriptions, your pharmacy, and your budget. Here is how to compare plans without getting burned. Every year, I meet people like Debbie, smart, responsible people who carefully compare premiums, choose the least expensive option, and assume they have done their homework. But the monthly premium is only one piece of the puzzle. A $5 plan is not a bargain if your medication is not covered, comes with restrictions, or costs significantly more under that plan. So before you choose, let's walk through 6 simple steps. First, create a complete list of every prescription you take. Not my blood pressure pill, not that little white tablet. You need the exact medication name, dosage, quantity, refill frequency, brand name, or generic version. Debbie had entered the name of her medication but selected the wrong dosage. That tiny detail changed the estimated cost. 2 versions of the same medication can have different prices, coverage rules, or restrictions. And do not leave off a prescription simply because it is inexpensive today. Plan coverage and pricing can change. Your medication list is the foundation of the entire comparison. Make it precise. Next, confirm that every medication is included on the plan's formulary, the list of drugs the plan covers. But do not stop when you see the word covered. That word can hide a few surprises. Check the medications tier and see whether there are any extra hoops, like prior authorization, step therapy, or limits on how much you can receive at one time. Prior authorization may require additional information from your doctor. Step therapy may require you to try another medication first. Quantity limits may restrict how much the plan covers at one time. In other words, a prescription can technically be covered while still making you jump through a few hoops to get it. Now, enter the pharmacies you'd be willing to use. And this is where Debbie found her second surprise. She loved her neighborhood pharmacy. It was convenient, the staff knew her name, and they even kept her favorite hand lotion behind the counter. But with her new plan, that pharmacy wasn't considered a preferred pharmacy. It was a standard network pharmacy. That meant the exact same medication cost less at another pharmacy nearby. So compare the actual cost at your current pharmacy, a preferred pharmacy nearby, the plan's mail order option, if you're comfortable with that, and don't assume mail order will automatically be cheaper. Sometimes it is, sometimes it isn't. Check the actual numbers. Convenience matters too. Saving $4 probably isn't worth driving 30 minutes across town every month. You're not simply looking for the lowest price. You're looking for the option that works best for your medications, your budget, and your life. Now we're getting to the number that really matters, your estimated total cost for the entire year. That number may include your monthly premiums, the deductible, copays and coinsurance, what you're expected to pay for your prescriptions throughout the year. A plan with a higher monthly premium could actually cost you less overall if it covers your medications more favorably. And that's exactly what Debbie discovered. She had ruled out one plan because the premium was higher, but when she looked at the total yearly cost, that plan could have saved her hundreds of dollars. The plan that looked the cheapest wasn't actually the least expensive. 2 plans may have similar yearly totals, but very different monthly expenses. One may require you to meet a drug deductible early in the year. Another may offer more predictable copayments for certain medication tiers. So do not only ask, what will this cost for the year? Also ask, what might I have to pay in January and February? That matters when you are managing a household budget. The Medicare prescription payment plan may allow eligible Part D costs to be spread throughout the year. But remember, it changes when you pay. It does not reduce the total cost of your medication. Debbie's final mistake was assuming that once she chose a plan, she could forget about it. But prescriptions change. Pharmacies can change their network status, and plans can change their premiums, formularies, drug tiers, deductibles, and cost sharing. That does not mean you must change plans every year. It means you should make sure your current plan still deserves your loyalty before allowing it to renew automatically. By the following enrollment season, Debbie approached the process differently. She gathered her prescription bottles, confirmed every dosage, compared pharmacy prices, reviewed the restrictions, and looked at the full yearly cost. This time, there was no unpleasant surprise at the pharmacy counter, just the quiet satisfaction of knowing she had made an informed decision. Because the right Part D plan is not necessarily the one with the lowest premium. It is not always the one with the most recognizable company name, and it is definitely not automatically the plan your spouse, friend, or neighbor chose. It is the plan that provides the best overall fit based on your medications, your pharmacy, your restrictions, and your total expected cost. To help you get organized before comparing your options, download my free Medicare open enrollment checklist using the link below. And that's Medicare minus the headache.